Hey Stillwater, welcome to the Still Connect podcast, a podcast all about Stillwater, Oklahoma. I'm your host, Denver Evans, born and raised Stillwater local and owner of Stillwater Digital Marketing. Every Wednesday, I share a friendly chat with someone in our community that's helping make Stillwater such a great place. Whether you're a longtime resident or just a visitor, this is your place to plug in, stay inspired, and still connect with the stories that shape our community. And if you ever want to watch these interviews, you can check them out on YouTube. For this episode, I got to sit down with Dr. Kelsey Smith with Pioneer Health DPC. Let's jump right in. How are you?
Excellent. Welcome to our place.
Yeah. So for people out there who are unfamiliar with Pioneer Health, tell us a little bit about yourself and what you do.
Sure. I've been in Stillwater as a family physician since 2007 and practiced in the kind of normal expected insurance-based realm for 14 years and finally decided that insurance-based care has a lot of misaligned incentives that don't allow me to take the type of care of my patients that I wanted to. And I'd been looking at a concept called direct primary care since about 2015. And in 2020, as a lot of people did, took kind of stock of the situation we were in and decided it was time to make that jump. So direct primary care is what I practice now. I got out of all my insurance contracts. And while all of our patients, most of our patients have insurance, we don't bill it. And sometimes people say, well, that doesn't make any sense. I have insurance. That's what's supposed to take care of my care when I go see the doctor. But most people have had an experience in the healthcare system where that hasn't been the case. Mm-hmm. They're like, well, this was supposed to take care of everything, and yet I still ended up with a huge bill. Mm-hmm. Direct primary care works more similarly to a gym membership. So my patients pay a monthly membership fee. Then once they are a member of the practice, they can text, they can call, they can email, as well as in-person visits. And when the need arises, I even do house calls. So it brings the personal aspect of having a doctor that knows you and that you can reach out to when you have a need, rather than basically the false security of an insurance card in your pocket that, well, if I ever need anything, this little piece of plastic is going to save me. That's just not the case. You know, you'll end up in urgent care every time or in the emergency room unnecessarily, rather than having a personal relationship with a doctor.
Mm-hmm. That makes sense. So what got you into medicine in the first place?
Yeah, so we were just talking before this started that I was an OSU Cowboy. So I came here from Newkirk, Oklahoma, was my hometown. And when I came here to OSU, I really thought I would go into veterinary medicine. I grew up on a farm and I love animals, still do, but they make me sneeze really badly. And so I was determined that I was going to overcome the nasal allergies as well as allergic asthma that I had developed. But every time I went to a vet's office to do some shadowing or, just check it out, I'd have to leave by lunch because I literally couldn't breathe. Mm-hmm. So I went to an allergist and asked them, how do I overcome this? And told them I want to be a vet. And they looked at my allergy reports and they were like, no, you're not going to be a vet. But I was still pretty stubborn. I was like, well, you can't tell me what to do. I'm going to do this. And then finally decided that as allergy shots weren't working and I was continuing to struggle, I was like, somebody's trying to tell me something here. And decided maybe people weren't so bad. And started to kind of shift my thoughts into the realm of human medicine, and decided that that was a better way to go for me and my personality anyway. I really didn't think I would choose primary care when I went to medical school, but it wasn't until I got into the clinical years and realized that there really wasn't an aspect of medicine I wanted to leave behind, that family medicine came to the forefront and became the specialty that I chose and has fit me well.
That's really great. So when you say your clinical years, what does that process look like?
Yeah, so medical school is split up into kind of the didactic years where you're learning a lot of basic sciences and your nose is in a textbook, you're taking a lot of tests. That's typically the first 2 years. And then the second 2 years is clinically based. So you're in the hospitals, you're following attending physicians and resident physicians who are further along in their training, and you're learning from them by example and from clinical cases. That is shifting somewhat because people are realizing that the medical education, just traditional schedule can be adjusted a little bit. So OU College of Medicine, I'm on their interview board, but they are shifting to 18 months of pure didactics and getting students into a clinical setting a little bit faster.
That makes sense.
Yeah.
So when did you decide to take the step into having your own practice?
I went to OU College of Medicine for medical school, and then OU family practice for my residency training in Tulsa. And the kind of routine, expected thing in today's healthcare, environment is that when you finish training, you interview with all the big hospital systems. Maybe Mercy or Baptist or here in town, Stillwater Medical Center. And they offer you a contract and you become a contracted employee, which was what I planned to do. The biggest thing that was unique about my situation was I planned to deliver babies at that time. And so was looking for a situation where they were looking for a family medicine doctor that delivered babies, which is a little bit unique. And then I got a call from Dr. Kelsey Smith here in town who said, we're actually looking for somebody to join our group, and that's exactly what we do. So my husband and I didn't really think we would ever come back to Stillwater. He's an airline pilot, and we kind of figured we'd end up in a bigger city where he could fly directly to and from our home. But we had dinner with the Smithtons and Dr. Schreck and decided that Stillwater Family Care was going to be a great fit so that we would have that call group and some support to deliver babies, and that's how we ended up back in Stillwater.
Very cool.
Yeah.
So is that how you started your own business?
Well, it's a private practice, Stillwater
Okay.
Family Care. My old partners are still running that to this day. And it has always been a private practice. So yeah, that's how I kind of dipped my toes into, I suppose, entrepreneurship without having to start my own business per se, because it was already running, but I came on as a partner into that practice. And I really have to give them a lot of credit, as well as Ms. Stephanie Heineman is the clinical director there, who taught me a lot of hands-on business knowledge. I never could have started my own clinic the way I have now without that background with them to say, no, this is how you run a medical practice, and successfully with that. So I think that saved me a lot of trial and error along the way to have had those years where I was learning so much.
Yeah, that makes sense. So what's been your favorite part of your work?
So I really, really like the fact that, I could go on and on about the benefits to my patients, but and I love that, I really do, but I can't say that this decision was totally altruistic and unselfish. Like the biggest thing I like is being able to disconnect a bit from my work, which a lot of doctors who look at direct primary care don't think that's possible, because they're like, well, your patients can reach out and text you anytime. How's that possible? But I have a much smaller patient base. In the insurance-based world, one doctor is typically responsible for somewhere between 2,500 and 3,000 patients. And then if you're part of a group, like I was, there were 5 of us. So when I'm on call, I would take call for everyone's patients. So you multiply that out. If we each had 3,000 patients, there's 5 of us. That's 15,000 people I'm responsible for the days or nights I'm on call.
Wow.
So that can become a little bit overwhelming. Not to mention insurance-based care puts a lot of pressure on doctors to complete documentation that has nothing to do with patient care.
Right.
It has a lot to do with just data mining and things like that they're trying to get from each individual chart. So I would be up late nights on weekends. My husband would ask, what are we doing this weekend? I said, I don't know what you're doing, but I'm doing charts. And so since switching over to direct primary care, now the lion's share of my day is spent doing work that actually applies to the patient's specific situation, whether that's in-person care or remote care. But the documentation is limited to what I feel is clinically necessary, none of the burdensome stuff that insurance used to require. And my nights and weekends are free. If something comes up, my patients text me and we take care of it. It's pretty much as simple as that. Very rarely, when emergencies do arise, New Year's Eve, I was up here and I drained some fluid off of a patient's elbow. But then we went straight to our New Year's Eve party, you know? So it's been a really great marriage for me. That's what I love about direct primary care is I can take better care of patients while also taking better care of myself.
That's really good. Yeah. It's hard for a business owner to take that time off, whether you're a doctor or whatever. Yeah.
Yeah, this allows me to do a lot of things remotely. We've taken ski trips, and I've only had cell coverage at the top of the mountain and was like, oh, I've got to sign off on these prescriptions while I'm up here where I have a cell signal. So,
oh my goodness.
There's things like that. I was in Spain this summer, and my staff was forwarding me things, and 8 a.m. here was 3 p.m. there, so I'd take care of some things while I was there. But it's just a whole different environment, I guess, so that it really doesn't seem as burdensome as it was when you're dealing with the entire kind of broken healthcare system as it's currently seen in America.
Mm-hmm. So tell us about that. So when you say broken healthcare system.
Well, there's so many misaligned incentives, right? So when I had contracts with insurance, I really didn't know what things cost. I would really figure that's not my role. That's between you and your insurance company, what medications are on formulary, where you need to go for specialty care, those types of things. And if there's a cash-based price, I really wasn't aware of it. We just knew, okay, your network is here, this is where you go. Your insurance will cover CVS pharmacy, so that's where you need your prescription to go. There really wasn't much more thought put into it than that. And the same thing with, because I was being paid by the visit, and that visit really had to meet certain criteria to qualify for billing through insurance, somebody could call in with the most simple of problems that really could be solved with a phone call or a text or an email. But those types of interactions aren't really quantifiable in the insurance-based system. So you couldn't get paid for it. So you could do it out of the kindness of your heart, which we would often do, but you knew you were losing money with every incident you did that way. So whether it's a hangnail or something very simple, nosebleed, whatever, that person needs to come in for an appointment. So then you can link a diagnosis code and a billing code to that, send it to insurance, and then anticipate that you'll get paid within about 90 days for that episode of care. Then at the end of that 90 days, it goes into a batch payment. I really don't know what I got paid. I could drill it down, but we're moving so fast, seeing 30 patients a day or whatever,
right,
that you don't really ever know how much you're getting paid or if you got paid for a certain visit or if it got rejected later by insurance until maybe a patient comes back 6 months later and says, hey, doc, I got a bill that says I owe $100 from that visit back in March. Why do I still owe you $100? And I truthfully couldn't tell them on, the majority of cases without my wonderful office manager looking into it and being like, oh, well, they have two insurances and it looks like we put the wrong one as primary and the other one as secondary. So that needs to be flipped around. And now it's not timely filing. So we probably aren't going to get paid on that. So now it's probably going to, it's either the patient's responsibility or we end up, eating that charge.
Yeah.
So there's all these little loopholes that don't come up for months at a time. And it just started to feel dishonest that I couldn't explain my own billing to my patients.
Yeah.
So now with direct primary care, it's very simple. We send out invoices every month. Our members know that they're going to be charged the monthly membership fee, which is $100 for an adult, $50 for a kid. And that has a family maximum of $350 per month. That comes out automatically, so they're anticipating that if that ever becomes something they don't feel like is helpful to them, that they don't want to be a member here anymore, they can cancel at any time. And then we do know now the cash pricing for imaging, for medications, and things like that. So now I can tell people, well, I can send this to your pharmacy, but it's going to cost you more there on your insurance than it is if I just give it to you.
Yeah.
A lot of common blood pressure medications, things like that, allergy medications. I can dispense 100 tablets for $2.50.
Wow.
Or $4, something ridiculous. And so a lot of folks are like, well, that's, how is that possible? Because, if I go to my pharmacy, my generic copay is $7, just like flat across the board. It's like, well, they're not going to tell you it's cheaper.
Right. That's how they make money.
Right.
Yeah.
So it's just, I feel like I can be a better patient advocate now, where before I was really just kind of a cog in a wheel. Mm-hmm.
That's amazing.
Yeah.
That's really great. I love that you take care of people like that. So what has your time in Stillwater been like?
It's been great. We have had 2 kids. My daughter is going to graduate from OSU this year.
Awesome.
She has a degree in hospitality and tourism management, or will come May. Mm-hmm. She's a graduate of Stillwater High School. My son's 16. He actually just recently transferred to Ripley High School.
Okay.
He wanted to be a part of a smaller school system and be on their baseball team. And so he is enjoying that. But we've been plugged in the community for the 17 years going on 18 that we've lived here, part of our church at Countryside, and I've been involved with all the different activities that our kids have been involved in, whether that's volleyball or baseball or band. We've really enjoyed plugging in where we can.
That's really cool. Yeah. So what are some of your favorite things about Stillwater?
I always think of Stillwater as like the biggest small town you're ever going to see. Mm-hmm. So coming from a town of 2,500 in Newkirk, Oklahoma, which was a true small town, like, my kids still marvel at, like, looking through my old yearbooks. They're like, who's this person? And I know everybody in the yearbook. They're like, how did you know them? They're like 4 years younger than you. I'm like, well, I knew everybody in the school. Mm-hmm. There just weren't that many of us. So obviously Stillwater's a little bigger than that. You're maybe not going to know everybody in your kids' classes and things like that. But you still get that feeling of a small town where when you go to the grocery store, it's unusual if you don't run into somebody you recognize or know. And by the same token, people know you outside of medicine. So, a lot of times people are like, oh, yeah, you're Dr. Smith. I know your husband. I know your mom. I know your dad, whatever. So you lose that anonymity, which is sometimes interesting, but but I wouldn't have it any other way. I love being a part of a community that, for the most part, seems to really take care of their own.
Mm-hmm. So. Yeah, Stillwater's great.
Yeah.
Where do you guys like to spend time around town?
So as far as places to go and things like that, we're not big on the restaurant scene because we like to cook. But we have been to Primetime Meat and Wines because we like to cook. So have picked up some of the chicken bones there and brought them home recently. That was a real fun thing.
Oh, yeah.
And when we do go out to eat, we like to go to like Hatch and things because they have things that are a little bit different. And Empire Slice is really nice, and Good Little Eater, all those nice places downtown.
I know, all those new places right over by 10th.
Yeah, so that's kind of fun. And, oh gosh, the Japanese place where you cook your own...
Tokyo Pot. Yeah, right next door to Good Little
Pot,
Eater. Yeah.
So that whole block has some of our favorite places. So.
Yeah, I'm so excited for Block 34.
Oh, it'll be so fun. Yeah, I can't wait to see what it looks like when it gets finished.
Yeah, that's awesome. Do you guys have any events around town you like to go to?
Well, really, we appreciate the high school sports scene, probably more so than the OSU sports scene.
Yeah.
We were talking about that a little bit before we got started. Pioneer sports are typically really great, and the cost of admission is less. Parking's better.
Parking and admission are a lot better.
Right. Yeah. So we really like going to some Pioneer football games, and like I said, my daughter was on the volleyball team, so enjoy following those sports teams and cheering them on as much or more than the OSU Cowboys, truthfully.
Did you mention that one of your kids are in band?
Yeah, my son was part of the Stillwater band before he transferred.
Oh, okay, cool.
Yeah.
What did he play?
He played saxophone.
Okay, I was on the drum line, so
cool.
So the Stillwater sport. I love football games.
Yeah,
it just takes me back.
Yeah, and marching band competitions, man, those are intense. So.
They're intense, but they're fun.
Yeah.
Yeah, I love growing up in Stillwater, and it was always fun getting to be in the Christmas parade and stuff like that. The drum line would always wrap our drums in lights, like the little battery pack lights. And
my daughter's in a sorority. She's a Chi Omega, and some of her sisters are from bigger towns, Dallas, Fort Worth, all that kind of thing. And they were at the Christmas parade last year, and her pledge sister was like, is this like a Hallmark movie? Where are we right now? Yeah. So definitely has that small town feel.
Mm-hmm. Yeah, and it's especially just as downtown is growing and becoming bigger, it feels more like that. I love seeing all the lamps wrapped with lights over Christmas and stuff like that. Absolutely. My wife's actually from Tulsa, and so she would come to Stillwater for OSU events and things like that growing up. But then when she came here for school, she saw downtown and was just I love this place. And I was like, you should stay. We should get married. And
it all worked out.
And here we are. So
that's awesome.
Yeah, it's really great. Yeah, I like I love all those high school events. Walk around's pretty fun.
Yeah. No, it is.
Oh, no, we're good. Sorry.
Okay. Yeah, walk around's great. I'm not a huge big crowd person, so we'll go try to hit the off hours when there's big events like that. But it is great, and I love it that people from all over the state like to flock to Stillwater for those big events. But I mean, most of us that are here as natives know if you're going to go out to dinner, it's kind of
you know
nice
when
if
to go.
Yeah, if you're not going to go to the football game, maybe go during the game.
During the game, yep.
Yeah.
Definitely the best.
Yeah.
Yeah, and another thing, Stillwater kind of becoming, with OSU, Stillwater has almost become kind of a touristy town, where I've noticed that a lot of businesses are starting to be closed on Mondays.
No, you're right. Yeah, because there's a lot of business traffic on the weekends.
Yeah.
And things. And I love that we have an active community. You know, we've got the area at Boomer and then Lake McMurtry, where folks are you're seeing a lot more people coming here for like the land run bike ride and things like that.
Oh yeah, Mid-South. Yeah. I talked to Bobby.
Mid-South.
No, you're good. Yeah. People still get it confused. Yeah. I talked to Bobby about it. Have you listened to that episode?
No, I haven't. I'll have to now.
It was a lot of fun. He told like the whole story of like the rebrand and why they did it and everything, and just like how big it is. Last year they had like over 3,000 people.
Oh yeah, it was great. So, like I said, talk about a destination. There were people camped out on the courthouse lawn. I mean, it was crazy.
I got to take some finish line photos. Have you ever been to the race?
Yeah.
Okay. Yeah. So you know how Bobby hugs everyone at the end? Yeah. I got to take some finish line photos for him last year. And
that's awesome.
It was so funny.
Yeah. My husband's actually signed up to ride it this year.
Oh, cool. Yeah. Very fun.
We'll see how that goes.
Yeah. I just love the whole atmosphere, the food trucks, everything. And
yeah, it's a lot of fun.
It's a good time. Yeah. I'm trying to remember how many countries he said were represented, but go listen to that episode, everyone, if you haven't yet, because it's a lot of fun. Yeah, that's great. So, so tell me a little bit more about just kind of why you do what you do.
Sure. I have two full-time employees, Joni Bradley and Angie Schweer, and they've both been in Stillwater and surrounding areas, Perry, for their entire lives. And so the three of us are really committed to taking care of folks in this community and realize what a great vehicle direct primary care is to be able to do that. So I think if you were able to ask any of our patients, I think they would say it's a little bit like being part of a family as part of this practice. You know, I might have to ask your name on occasion if you haven't been in a while, but you get a more personal aspect of care, and we really enjoy being part of a community in that way. My son is thinking about healthcare as a career, and that's one thing that I really want him to understand is, you know, we've talked a little bit about communities of faith and things like that, but the healthcare community really is a calling as well. And if it's not something that you feel like is what you're called to do in life, then I'd say don't do it.
Yeah.
Because it really does take that type of attitude for it to fill your cup rather than just drain it. And I feel really, really fortunate that I have a team with me that is totally on board with that mission, and it's their personal mission as well.
Do you feel like a lot of people get into medicine for the paycheck?
You know, I think there's still a little bit of mystique around that, like, oh, you're a doctor. You know, I want to be a doctor when I grow up. You know, our parents want their kids to be a doctor when they grow up. I think we're seeing that change. I mean, just with the headlines, you know, with the United Healthcare CEO being assassinated recently, people are starting to realize that healthcare is not the cheery place that, you know, they might have once thought it was for doctors or for patients. And so, unfortunately, I think there's a lot of people who might otherwise see that as their calling that avoid it now because of the kind of the mess that they start to see. Oh, wow, well, I thought I wanted to help people in this way with my life, but you know, maybe I would do better if I go in a different direction, because they might see how that would, you know, affect them personally in a negative way. So I think we do have to find different ways to take care of the caregivers better. Direct primary care is just one way of doing that, and there's one way I did it for my own personal health. But I think, like I said, being part of the OU medical system on their interview team and seeing how they're changing medical education, I think, in a positive way, I think we can make some changes that will definitely help encourage the next generation to enter medicine with their eyes open and still have hope for the future.
I know you mentioned it earlier. So what are some of those changes that they're making? Yeah,
so getting people into clinical exposure a little bit quicker, so that they, you know, there's so many ways now to get an education in medicine. You know, what if you want to be in clinical care, you can be a doctor, you can be a physician's assistant or a PA, you can go the nursing route, become a nurse practitioner. And that's what I think a lot of people were seeing was, well, gosh, it's so cumbersome to become a physician. Why would I do that? It's more efficient time-wise and things like that to become a PA or a nurse practitioner, and you have more flexibility in your field of practice after you get out of those kind of allied health professional schools. That if you decide you want to do dermatology right out of training, you can, and then say, well, you know what, dermatology is really not for me. I would rather practice in a cardiology office. You can. If I were to decide I wanted to do cardiology, I'd have to go back and do a cardiology residency for several years before I could come back and do that. Mm-hmm. So I definitely can see where, like you were talking about, becoming a doctor becomes a little bit second tier. And so trying to facilitate a little bit of changes that make that not as onerous maybe and cumbersome to become a physician, then while it's obviously still going to be difficult to get into medical school and things like that, trying to make it not so much a trial by fire as it's always been.
So what would you say to someone who's thinking about getting into medicine?
I definitely would still recommend it, but I would ask them, is that the only thing that you think is going to satisfy your desire to help people? If you feel like, running a food truck would just as easily satisfy your desire to help people, then it's probably better you go be an entrepreneur and run a food truck. Like, it's not worth the time and commitment and financial investment, all those things to go through medical school if it's not really the only thing that you see yourself doing.
Yeah.
And that takes some exploration. Like, say, my son right now is kind of interested in healthcare, but I would definitely encourage him to look at the entire options that are out there, because the sacrifice it takes to go to medical school and become a doctor is not for everybody.
Mm-hmm. That makes sense. So how about yourself? So you chose to not only go into medicine, but also to be an entrepreneur.
Sure.
So what how do you juggle all of that?
Yeah, so it is kind of interesting as far as being an entrepreneur in medicine is not as common as it once was. It used to be your doctor would just hang their shingle, right? You'd have the family doctor for the town or whatever, came out in their buggy or whatever to take care of whatever ailments people had. And now, because of the corporatization of healthcare, you typically associate your doctor with a system, right? Well, I go to Mercy Health, I go to Stillwater Family Care, I go to Stillwater Medical Center, whatever, rather than an individual necessarily. Some people still do, have that personal relationship with one provider, but it's harder and harder as things become corporatized. And I think there is a trend, just like kind of the rebirth of small business in general, away from maybe the Walmarts and Amazons and things like that, to supporting a downtown business, that doctors are starting to realize, hey, wait, I know how I want to treat my patients, and I know what I want my practice to look like, and it may not look exactly like the Amazon of healthcare. So they're starting to take that back, just like you're seeing more people take that leap into entrepreneurship and other business sectors. So.
Mm-hmm. That's actually why I started the podcast, was to just help support Stillwater-based businesses. Yeah. And so, which is funny, I didn't know that you felt that way about any of that before doing this podcast. So I'm glad.
That's awesome.
Yeah, that's really cool. So, so how can individuals support businesses like yours?
Yeah, so obviously if they feel like they have a healthcare need that's not being met, check us out. Our website is www.pioneerhealthdpc.com, and we've got a Facebook and Instagram page and even a few TikTok videos out there if you want to learn more. But just even if it's not with my practice, the local physicians that you have involved in your healthcare, try to see them when possible. Rather than seeking out urgent care or an emergency room first, try to get in to see your doctor, because it's easier for us as physicians when we see that total view of your health to take better care of you. Mm-hmm. At Stillwater Family Care, where I practiced for a long time, we would preach that, often, like, call us first, like, don't assume we're too busy to see you. Mm-hmm. We would always rather take care of our patients, because knowing them and knowing their background, you're going to get a more personalized treatment plan when you see your personal physician than if you see someone you've just met walking in the door. So I would say I try to develop a personal relationship with your physician or provider and see them whenever possible.
That's great. So what about somebody, because we're recording this kind of towards the beginning of the year, What about all the people who just signed up for health insurance?
Yeah, so health insurance, I mean, we've had lots of conversations with individuals and businesses over the last few months because we call it the BUCAs, the Blue Cross, United, Cigna, Aetna, and Health Choice. Those are some of the biggest names in the healthcare industry right now. And people kind of assume, and businesses sometimes rightly assume that, well, I've got to sign up with one of these big names, and that's going to make sure my employees, my family is taken care of, which unfortunately is not always the case. So if you've got a new insurance plan, great. Definitely investigate the ins and outs of it, but realize that in this evolving healthcare landscape, you're not confined by it. So like I said before, sometimes your insurance will say, well, you've got to get your prescriptions from this mail order pharmacy, which negatively impacts our small town pharmacies. Tiger Drugs, Central, Charlie's, all of those guys are struggling to work within the corporate framework of medicine as well. And so, like I said, sometimes you can figure out, well, that's great. You say I have to use Express Scripts, but doc, will you send my prescription over to Drug instead? And even if insurance doesn't pick it up, a lot of medications are not that expensive. So you can say, no, don't file my insurance. What's the cash price on that? Yeah. And a lot of times you'll be happily surprised that you are able to walk in again to see a staff that you know and trust that is going to have your back looking over your medications and things, rather than some anonymous mail order pharmacy that doesn't know you from the thousands to millions of patients that they fill prescriptions for. Yeah.
Very true. That makes a lot of sense. Yeah. All right. Well, to finish up, do you have any final thoughts?
I'm really glad that you decided to do this. I've been on some podcasts in the past, some from a women in business type of perspective, and some from a pharmaceutical perspective, that type of thing. But it's really great to have somebody interested in Stillwater in particular. So thanks.
Yeah, that's what I was doing. I was looking around for Stillwater podcasts, and there were a couple kind of out there, but most of them had kind of stopped putting out episodes, or they just weren't kind of like topics of interest. They weren't interviewing people who anyone, just running around during the day might end up seeing when they walk into their business. And so just I wanted to give people an opportunity if they're busy or, they're not going to come in here and just try to talk to you and hear from you before thinking about, your service. They might just only see your website or something like that. I want to give people an opportunity to hear from business owners and then say, oh, wow, yeah, next time I think about X, Y, or Z, I'm going to check out that place a little bit closer.
Well, and I'll give you a chance to plug the podcast. How do we best go about listening to current and past episodes?
If you're hearing this, you're already there. Yeah. Follow on social media. I'll be sharing some clips. If you want to support the podcast, jump on Patreon. You're probably going to hear all this here in just a second when I do my outro. But awesome. Definitely subscribe if you want more content. So
sweet.
All right. Thank you so much.
Yeah, thank you.
Thanks for tuning in to Still Connect. I hope you enjoyed that conversation with Dr. Kelsey. Be sure to check out Pioneer Health on all their social media, linked in the show notes below. And if you loved today's episode, don't forget to follow the podcast on social for highlights, updates, and more. And if you loved today's episode, don't forget to follow the podcast on social for highlights, updates, and more, and share the podcast with all of your Stillwater friends. If you believe in building community through these conversations, consider supporting the podcast on Patreon, where, for less than the price of a cup of coffee, you can get early access to episodes, peek behind the curtain at the podcast process, and a shout out on an episode. With a higher contribution, you can submit questions for upcoming guests, make special requests for the show, get access to online Q&As, and even be on the podcast for an interview segment. No matter what your capacity for supporting the podcast is, every little bit helps grow this amazing community. And we all need community. So even when life gets busy, make sure you still connect.